Our next speaker is Peter Ravenscroft, who's going to talk about rural water supply and groundwater quality. Peter. Politely.
Okay. Good afternoon, everybody. I am a hydrogeologist. I work mostly with UNICEF and a little bit with the World Bank. And I'm taking the opportunity today to use what's called a soapbox to talk about some of the things which I think we don't do very well. But I'd like to exemplify how WASH and hydrogeology work together and some of the core problems. I mean, the WASH practices a tendency to be reductionist in their thinking and say even Procrustean. You know, the solutions looking for a problem. And, you know, WASH needs good hydrogeology to predict, understand and respond to these problems, especially unexpected ones. And other areas where both need to do better are in sort of effective output and impact monitoring, in sustainability and intergenerational equity, and generally condition of the human factor, which I haven't heard too much about. So, situation in Bangladesh, when you look at the standard MDG type of diagrams, they'll be familiar, those in the WASH sector already. You can see sanitation coverage is going high, coverage of improved water sources. Well, it looks great, what's the problem? But of course, the big problem that most of you will be familiar with, at least a little bit, is the arsenic problem. We've got, last count, 22 million people exposed over 50 ppb, 45 million above what's the standard in most countries. One key point here is, as a hydrogeologist, working particularly at the start with friends at UCL, identified the mechanism, and that probably did the most, I would think, the most important thing I've contributed to in my working career, and that was stopping government banning tube well irrigation, which would have done no good for food production and would not have solved anything to do with the poisoning of people by arsenic. Arsenic, as you may well know, has a huge range of clinical effects, going from the well-known sort of lethargy and weakness, a range of horrible skin diseases, internal damage to liver, kidney, 5 types of cancer, fatal deaths from heart disease and lung disease. The annual, very importantly, it takes something like 2 to 10 years for people to become sick, and the effects carry over from one generation to another. Even exposure in utero can result in deaths in the following generation. But one major change, Bangladesh is well known for sort of diarrheal deaths. The latest estimates, there are some methodological issues here, but put the estimated death toll of 42,000 a year from arsenic compared to 31,000 from diarrhea. But it's not just arsenic that's a problem. And I'll just very quickly give some data. Survey done with the Public Health Engineering Department. We went to try to basically survey every public water point installed in the last 7 years. We managed to do 125,000, of which about 20% are installed by UNICEF. Most of the rest have been installed by NGOs or with donor assistance. I would emphasise major failing is there was no systematic output monitoring almost anywhere across the whole programme. So I'm talking about not a UNICEF, not a Dunedin or anything different, sector-wide problem. We checked the functionality and arsenic by field testing at every site. And this was done through community hygiene promoters who are Class 7, 8 educated people and local and 1,200 local mechanics. We included 2-tiered quality control where government labs 10% check and then 10% of the 10% which act as an independent lab. We surveyed 57,000 deep wells, 49,000 shallow wells, 12,000 dug wells and 3,000 surface water devices, which just shows actually there has not been a large-scale return to using surface water. The whole process was done by reporting using SMS, and for the 1,200 mechanics, they were all paid by SMS and using mobile banking. The whole cost of the survey is including all the quality control analyses, reporting database, about $5 a point. So just quickly, to give you the idea of the other water quality problems, these are the things that people have been ignoring because they're focused on others. When you look at particularly the manganese, shallow tube wells, almost half of them are above the health guideline for manganese. Ring wells, something similar. If you look at the bacterial counts on E. coli, you're finding fecal contamination in sort of 30% of tube wells, but very rarely you're getting very high levels. The ring wells, almost all contaminated and at quite a high level. The surface water devices, even worse. And if you were to look at post-abstraction contamination, you can add about another 50% to those figures, except of course for surface water. And if we look at the other thing on functionality, because this comes from doing a follow-up, output monitoring was not happening anywhere across the sector. We look at the performance of these over the 7-year period based on their age. You find basically deep tube wells working pretty well, 91% of them are still working after an average of 6 years. Shallow tube wells, something not quite so good, but you go down to other technologies, we're dropping down to almost half being abandoned in that period. And I would just ask something none of us ever seem to do. Why no warranty when we do water supply? 20% abandoned in the first year? I mean, what's just a complete waste of money, isn't it? Example of misguided policy affecting us, where hydrogeologists were absent. In the early 2000s, people were probably angry with hydrogeologists because this is this arsenic problem and it's a groundwater problem and groundwater's bad and we've got to go back to surface water. That's the way forwards. And in some of these areas, like this example of Cachua or Brazilla, this is what people went in and promoted dug wells, which were strangely classed as surface water at the time, rainwater harvesting and pond sand filters and things like that. 2 years ago, the Japanese NGO went back and saw what the result was. 99% of the shallow tube wells are still contaminated. There were just 99 tube wells, basically promoting those alternatives and having either ignored hydrogeological advice or really not having taken any because we were persona non grata for some people. That was total failure. And as the graph at the side shows you, when there was a lot of testing going on, people stopped installing shallow tube wells, which have most of the arsenic, 99% contaminated. As soon as the testing stopped, people didn't know what to do, or they thought it's all over, and people started installing shallow tube wells all over again. And these people, people are dying because of it. So, don't you have 2 slides there? So how does arsenic effect play out in terms of the economy, in terms of people? I mean, it's clinically, it's debilitating, it's loss of income. It's estimated that have a loss of income. 13 billion.
I can't reach the lever from here.
$13 billion in lost income over 20 years. The stigma and isolation that affects women and children, women and girls in particular. They're taken out of school. The poorer people cannot afford to buy mitigation services. Children actually are rarely sick, but what happens is, I like the quote it gives the example is, if the parents become sick, then the children get taken out of school to go and work or to help in the house. And so these people who made themselves become sick when they're adult aren't able to get a proper education, and this feeds back. The girls probably can't get married, and so you get this knock-on effect into the next generation. Another thing on there, and somebody in the audience will recognise his own paper. So about sustainability, there is, I would say, don't just blindly accept even what you heard from Guy earlier about sustainability is not always the right thing to do. There was a policy adopted that opposed installing deep tube wells. Groundwater is the last option. But when you look at it, and hydrogeologists contribute by thinking about time. There have been different modelling and monitoring studies done. Bad things are going to happen to their deep aquifers, which people say must be preserved for future generations. It's the correct thing. It's the water framework approach. But what's happening? People are dying today in large numbers. Possibly 1 in 16 adult deaths could be due to arsenic. And what's the consequences of not doing this? The deep aquifer might get less arsenic that is now in the future. Whereas if you go for using those aquifers now, even they become bad in the future, you know this risk is there, you can plan for it, you can build in treatment of a lower level of contamination in the future and in an economy that's better off. So, as somebody said, who needs sustainability? Lastly, sort of almost summing up, what the needs, as I would see them, are for a much more holistic approach to water quality. The log frames that just give you year-round arsenic-safe water allow you to ignore the range of other problems. You need to take account of this balanced approach to looking at risk from fecal contamination and chemical contamination, and using the excellent work that Guy Howard and colleagues did on using this disability adjusted life years to assess this approach, to balance them. But you need to extend that to take in other chemicals like the manganese effect, which manganese affects the brains of children, and so you're going to have a huge economic loss in terms of education and people's ability to cope in the future. And there are approaches that can be done, and with a little more hydrogeological thinking, you can go towards an approach for Bangladesh that adopt it, shifting in most areas to low arsenic deep wells. You can also, in the process, in almost all areas, avoid high levels of manganese, but you have to balance the effect of high iron, and you've got to take in account here how aesthetics of water. People took iron's not health related, but if you try using iron water that's got 5-10 ppm of iron in it, people don't want to drink it. They don't want to wash in it. And then what happens as a result? People go and use an unsafe source. So a rational strategy is possible, but there are real difficulty for the institutions and the people that, because they'll say, stop, you're overloading us with problems, we can't cope with that. And that's where, in our profession, in hydrogeology, we can help to try and manage this uncertainty. So, just summing up, I think there's a huge potential for hydrogeologists working in WASH, and huge benefits to the WASH community. And it's limits only by your imagination, but things that need to be done that haven't been mentioned so far about building relationships and trust and mutual respect with institutions in those countries. It's no good just, parachuting into countries with advice or just a guidance booklet that isn't backed up by personal contact. We do need more opportunities for young hydrogeologists to get abroad and see the world for themselves. Our generation was lucky, we had that. Being careful of these logical frameworks have genuinely have many advantages, but they can also trap your thinking and blind you to the other problems that really affect people. And we have to spend more time observing what's happening, listening to the concerns of people in villages, in slum areas of towns, and lastly, to just believe in the possible and not to think things can't be done. There's enormous amount you can do, even without a big budget, if you build on those relationships with people, build partnerships in the developing countries. Thank you.
Paul Hutchins from Cranfield University talked about moving, or us as a kind of development community, providing advice, moving people away from shallow to deep aquifers perhaps, but a lot of aquifer or boreholes that are drilled are done by households that through the private sector in West Bengal at least, and in parts of Bihar, but I don't know Bangladesh myself. So it's more about how can hydrologists help, or with policymakers create incentives for people that are drilling boreholes through the private sector, which many households do, to they normally will drill a very shallow borehole because it's cheaper, and the hand pump you need is also a cheaper type. So about whether there's kind of incentives or a role for hydrogeologists to help shape policy levers in that kind of area.
Yeah, I mean, your point is correct. Those deeper options are more expensive. They're still cheap by global standards. You're talking about $800 for a 300-metre well. So by African standards, forget it costs that much, 5 times that much for a standard hand pump. The challenge that you identify is absolutely right. A lot of activities have been started by government and then taken over by the private sector. There's 2 things we can do. As hydrogeologists, we can make the intellectual case for the practicality of using the deep aquifer, because it gives you not only the low arsenic, gives you the lower manganese, and minimises the fecal contamination risk. The challenge is to create a private sector mechanism that allows ordinary people to access these install deep wells by better ways of putting subsidy that doesn't go only through government departments and big sort of donor-assisted or major international NGO projects. And that is something, I mean, we're trying to argue for at the moment, and I think it is the key to getting rapid implementation and mitigation.